Right, great. I'll go on. So again, I'm going to be on the Facebook and Instagram. I'm going to be joined by a colleague, and we're going to have a chat. So you should be able to hear his answers to the questions that I'm planning to ask. But you won't be able to see my colleague, who is a surprise. I don't want to just tell you exactly who it is. He's a very well-known implant dentist, and he's kindly agreed to come and chat. And I've got a few questions to ask him about his mindset, how he got to where he is, and what advice he'd give young dentists starting off. So I'm just going to go Instagram live also, and the beauty with Instagram is, when I'm chatting to this colleague, when he comes on, you'll be able to see him. So you'll be able to, it's a split screen, so it's really, really quite cool. So I'm just going to go on Instagram and go Instagram live. And to recap, I had a great feedback from my Facebook Live last week when I talked about 5 key things that young dentists, implant dentists starting off, that really need to focus on. I talked about courses, I talked about mentorship and coaching, I talked about building your own brand and engaging with social media, I talked about just getting started in implant dentistry and how to get the work in, and finally I talked about setting yourself goals. So we're going to recap on those as well. Let me just go on Instagram and go live and connect. Again, any questions? So the focus again is on starting off in implant dentistry. If you have any questions about my past and my training in implant dentistry, then fire away. I've got a couple of colleagues going to come on. First colleague, we'll just wait till he joins me on Instagram, then I'll bring him on and then I'll introduce him. And then my second colleague is a young implant dentist, and he's got some questions for me about, my thoughts in what you should be doing now early on in his career to have the biggest impact. So I spoke to him this morning and I said, let's go on it live when I'm on live 5, and I want everybody to know the answer to these questions, because I think it'll be really useful for a lot of dentists out there. So I've turned the music down. So to recap, as we're getting a larger audience, I am live at 5 again. I'm on Facebook, I'm on Instagram. I have a really well-experienced colleague joining us. He's kindly offered to join in a short discussion where I'm going to ask him some questions which I hope will benefit everybody. He's so experienced, and he's going to share some of his experience with us. So carrying on from my Facebook Live last week, we're going to focus on the key things that a young dentist starting off in implant dentistry should be focusing on. And last week I talked about identifying courses, getting advice from other colleagues on what is the best course to help you in your career. Secondly, having mentors, coaches, having people to look up to, thinking about your environment. Remember, it's a well-known saying, we are the sum of the 5 people closest to us. So really focusing on that and thinking about that in our dental environment. If we're around great clinicians, they will push us to be better. Focusing on social media and engaging, because it's a world of information. Building a brand as a clinician. The fourth point I sort of mentioned was trying to get the work, and how you when you're starting off, it's always a slow burner. So how do you get the work in? And maybe that's doing a discounted rate, maybe that's treating friends and family, maybe that's treating colleagues within the practice at a discounted rate, just to get your numbers up and your experience up. And then finally setting yourself those goals, and not just telling yourself them, writing them down and checking on them, on your progress, trying to achieve those goals. So I'm going to bring in my really well and he is going to join. So I am really super excited to have Martin Wanendeya, who's kindly agreed to speak to me for a few minutes this evening. And Martin, thank you so much. And Martin is going live, doing a live webinar today as part of the oral reconstruction group, which we're both members of. And I'm going to get him to tell us a bit more about that. And you can still sign up to his webinar this evening. I've heard Martin speak, and you're really in for a treat. So I'll put the link up on the feed after this live stream finishes. So if you've not signed up already, get on. It's you will not be disappointed. Martin, thank you so much.
Hello, Farhan. Thank you for the invitation to come and join you on your live feed.
Pleasure. Let me just turn up the volume so the guys on Facebook Live can also hear you. So everybody, if you're not on, you won't be able to see Martin on Facebook. So if you can come across to my Instagram channel, you'll be able to see him and get the best experience, because it's a wealth of experience, and I'm going to ask him some probing questions that I hope will really benefit some young implant dentists. So Martin, you're on at 7:30?
7:30 UK time, that's when I'm on, and I'm talking about, in fact, Congress has been a wealth of different people from different, this brings the group who are Max, and we have the experience to share with everyone different aspects of implant, of our philosophies on how we treat implants. So I think it's a great concept that George has put together. And my subject is FP1 versus FP3, so I'm talking about all white solutions versus pink and white, how you might decide if one is suitable or the other. It's really about the thought process, and obviously there'll be a case or two in there for everyone to hopefully enjoy.
Okay, fantastic. So I don't know if everybody on Facebook heard that, so I'm just going to briefly summarise. Martin is on at 7:30 today, and he's going to be talking about FP1 versus FP3. FP1, FP3, I've talked about it before, the Misch prosthodontic classification. He's going to tell you all about it, how to manage these cases, what the pros and cons are. So 7:30, and I will put up the link on my feed. So please sign up the webinar. Also, to let you know, as we've got a series of webinars on this week, all around full arch. We're going to take you from talking about FP1 prosthesis and implant surgery, full arch implant surgery, conventional full arch. We're going to talk about pterygoid implants. We're going to talk about zygomatics. So you're going to get a full range all this week, and the links are all over Facebook, and I will put them again on my feed. So please sign up. We're really fortunate to have a wealth of experience within this country, and they've offered to do these webinars for free. So Martin, what I really wanted you on for was to ask you some questions so we could help our younger colleagues who are starting off in implant dentistry. So if I just get on, because I know you're busy and you need to prepare for this this webinar, because you're on shortly. First question I wanted to ask you, if you were to think, what has been the underlying driver to what you've achieved within dentistry?
I think really it's what I do.
The connection's poor.
To work. I enjoy just
Yeah, I know, Imran. I'm on Instagram Live, and the connection with Sorry, Martin, your connection isn't very good.
Okay, let me just pull out and pull back in.
Okay. Yeah. Okay.
And it might be better if I pull out and pull back in.
Yeah, that's fine. Okay. Sorry about that. So I'm on Instagram with Martin Wanendeya, who's kindly agreed to have a little chat to give advice on, you know, where to get started with an implant dentistry and how it is that he got to where he is, and just to help out a younger colleague. So the connection was poor, so we really couldn't hear what Martin was saying, so he's just going to come back into the call and then I'll bring him back in on Instagram. If you're on Facebook, move across to Instagram, because you'll be able to see Martin and get a better experience. So if you're on Facebook, come across to my Instagram site and we'll be able to chart to Martin. What I want to say is, recapping for the 5 things I sort of mentioned last week on my Facebook Live regarding how to get started in implant dentistry, things to focus on. Number 1, you know, identify courses and think about the investment you're making. You know, just be wary. A lot of people spend a lot of money on courses, not just implant dentistry, but a lot of other courses, and you know, you want to be getting a return on investment down the line. And so think about that. Think about what your initial investment is and how you're going to get that money back, because I think that's important. Also, think about asking other colleagues for advice in terms of courses and get feedback, and not just from colleagues but other clinicians that have attended the courses, you know, so get some feedback regarding their experience on the courses. So that was the first point while we wait for Martin to come back. The second thing was mentoring and coaches and having, you know, people to look up to within dentistry. I've had mentors. I have mentors. They have been really influential in my career and my development. We all need to have them. You know, we will all get to a place, but wouldn't it be better if we got there faster? And that's what a mentor or a coach allows you to do, to get to your endpoint faster, or helps you on your journey. So Martin's come back. I'm going to add him in. And so I'm just waiting, and we'll continue the conversation with Martin. So he was on the first question, and the connection really wasn't good. So I'm going to try and bring him back on and see what that's like. So the first question I asked Martin was, what has been the underlying driver to his achievements within dentistry? So I'm just waiting for Martin to join me on Instagram. And a reminder, Martin is live today, doing a live free webinar at 7:30, part of the oral reconstruction group, and he's going to be talking about FP1 versus FP3. I'm going to try, we're having a bit of problems. So he's going to be talking about FP1 versus FP3. I've spoken about FP1 versus FP3 in my previous Facebook Live. Such an important classification to understand, and Martin will be, I don't want to go over it again. You can either go to my YouTube or go down my Facebook feed and revisit, or tonight 7:30 sign up to the link and you'll hear it all from Martin. Great, Martin. Sorry, we lost you.
I hope that's better this time.
Yes.
Yeah, I managed to throw the kids off the Wi-Fi for a minute, so hopefully that's better.
Yes, amazing. Right, so can I just ask you that first question again? What has been the underlying driver to your achievements within dentistry?
I really hope there's still a lot more to come, is the first thing that I'll say, because I think that I'm just starting to enjoy some of the things that I'm doing. One of the things I feel has helped is basically a drive to do better for my patients, a drive to do better for the dentists who I work with on referral, and all the time trying to take on board the best of what I see around me in terms of the people who I see working really well, the techniques they're using, trying to learn them, and at all points, you know, looking back at what I do and thinking, look, what can I do better? What can I learn? What more is there to do? And I think that's always been there. That's something I think my mother, you know, drove into me from a very early age, my father as well. So within all of that, it's just carrying that on. And the other thing that really helps is having
it's going a bit of a delay again. Yeah, sorry, just a bit of a delay. I think Martin's away. So the first question I had for Martin that he was answering, well, what's been the underlying driver to your achievements in dentistry? Maybe I'll answer these questions. I'll ask myself and answer these questions. I think for me, it's always to get better day by day. You know, as long as I'm better than I was yesterday, it's progression for me. I did dentistry and then I studied medicine, and it was about getting better, more education, training, and ultimately to become a better clinician, to give better patient care. And that's been the driver, and it's the driver today, where I'm constantly pushing myself to learn more and more. The second question I was asking Martin was, name one person who's had the biggest influence in your career. So within dentistry and medicine, I've been very fortunate early on in my implant journey. I had Abid Fakir mentoring me. He's also my business partner. And then later on, the last sort of 4 years, my colleague George, who I work really close with, have had huge impacts in where I am today. I was then going to ask Martin about what important quality trait do you feel has been the most important factor in your success. I think the most important is resilience. You just got to keep going. Don't give up. Just keep going. When you face challenges, you've got to see them as growth. So when you face a challenge, it's growth. You don't look at it as a negative. You think, to achieve anything, you're on a journey, and challenges, obstacles are all stepping stones in that journey. The next question I was going to ask Martin was, there's an 80-20 rule. So what is in your work, what is it that you work on in 20% of the time that gets you 80% of my success? For me, it's networking, speaking to other colleagues, being involved in education. I am a big believer that's so important. Networking with colleagues, trying to help other colleagues in any way, shape I can, and I feel that helps me so much in what I've wanted to achieve within implant dentistry. And then, what advice would you give implant dentists starting off? The number one thing I tell implant dentists starting off is you need a mentor. Single best thing that you can do is identify people to help you. You need a mentor. You need a mentor. You need a mentor. Right. So enough of me. What I'm going to do is I'm going to try to get Martin on another time, because we've really struggled with the connection, etc. Let's see. I'll try one last time, if he's able to. Remember, Martin is on at 7:30 today. Live webinar. Martin's moved. Great, Martin.
I've moved, and this should be better now, basically.
Okay. So I think we've got the first. So if we move on to the second question, Martin, if you were to name one person who's had the biggest influence in your career, who would it be?
I think where you start is really, really important. And for me, it was my PE trainer, Tahir Ali. He was really, really instrumental. He ran a mixed practice. He allowed me to do a lot of very extensive work at a very early age. And I think working alongside him and seeing his philosophy of making sure education was the cornerstone of how you proceeded, using evidence, learning as much as you can, treating people, even though that was beeper item on the NHS, treating them to the best standard you could. That's really where I think, that start was really useful. Later on, I'll probably cite my tutor on the diploma, Paula McHenry. I came with lots of restorative skills, but not really a huge amount in terms of surgical skills. And she really, really taught me how to do surgery in a way that I didn't learn before. I could do the restoration, but she really, really helped me nail the surgery. So I'll put those two into that category.
But I think it's really important to highlight to younger colleagues listening in, but you can identify people that have had a substantial influence in your career, and I echo that.
Absolutely. I mean, there's the people who give you time when you really don't know very much. Yeah. The people who spend 5 minutes at the end of the lecture, explaining that thing that you didn't quite get. There's the people who reply to the emails, the people who then send you links to their articles. And I think you've just got to make sure when you meet people who are prepared to give you that time, that you respect their time. You know, you don't take the piss with their time. You really, really do respect their time. You respect their opinion, and you use the information that you gain from them to make you better.
Yeah, great word. Thank you, Martin. Excellent. Yeah, absolutely. So, moving on, what important quality or trait do you feel has been the most important factor in your success? So, from a personal point of view, what quality do you possess that's been instrumental?
I think I never give up. I think I just keep going. I just keep trying. I'm very dogged in some ways.
Yeah.
And, you know, sometimes people might see a lovely face and they think, oh, he just sailed through that.
Yeah.
You know and I know, and we're talking about immediate load. You might be halfway through the most difficult immediate load with the patient kicking off. The photos only tell half the story, but what you had to go through. And I think it's that determination to keep going, keep trying, you know, stand firm on your principles. If you've learned it, you know, you just have to keep going and keep trying and trust in what you've learned. So I'd say it's that determination to just keep going.
Yeah.
You know,
So it's interesting because while you were off connection, I answered the questions from my own point of view, and I said resilience. You know, just keep going.
Yeah.
You just got to keep going. That's it.
Yeah, definitely.
Okay, so second last question. So they talk about the 80-20 rule. So what do you do 20% of the time that has, then that has led to 80% of your success? What would you say?
I would say it's the reading and the research amongst things which aren't quite there yet. So techniques which are interesting but are not quite there, but require a lot to understand them. They might not appear to work or to be there on the surface, but you have to look really, really deeply into them. But once you've done that work and that research, and you spent a lot of time for very little gain, once you can then apply that knowledge really, really easily and in a very straightforward way. For instance, learning how to do, for large in implants, lots and lots of research, lots and lots of learning, lots and lots of research. The first case takes ages, but then it becomes much, much easier once you've invested the time. So I think it's investing the time in learning is that part that I'd say is I really enjoy, and it's really
There's a quote I love, and it's from Tim Ferriss, if anybody follows him, and he talks about learning before earning. The focus should all be on the learning. Forget the earning, that will come. Just if you focus on the learning, the earning will follow. And you've just
absolutely. And also, when you're entering something like this, you can't expect to make a lot of money straight away. It will take you. I remember saying to people, it's going to take you 3 or 4 years to make, earning money out of implants. But they're like, no, I want it now. It will take you 3 or 4 years until you get to the point where you can do it predictably, easily, confidently, do it well enough. But you need to invest that time. And if it's what you want to do with your life, brilliant. But if you're just in it just for the earning, I think that's where you'll fall down. I really believe that.
Right, Martin, before you can get it off and prepare for your webinar this evening, some advice. What advice would you give a young implant dentist starting off now?
I think the first thing I'd say is something I've heard you say a few times, a mentor. A mentor is hugely important. And I mentor people the whole time, and it's incredible to see how sometimes just, you might be there for the whole day helping them, but 5 little steps along the way are the 5 keys that help them make that case a success. That might be 10 minutes of time, but it's taking you a long time to learn where someone is going wrong and how to correct them in the right way. The other part I'd say is to learn to restore properly first, to understand the restorative procedure. Because people don't buy implants, they buy teeth. And you need to be able to deliver teeth. And if you understand how to restore and what to do and all the process around it, it makes the process of learning how to place implants and all the soft tissue grafting, bone grafting, guided surgery, immediate placement. It makes that bit much, much easier if you understand the basics of this is what you're giving the patient at the end. The other thing I'd say is to read and to learn. Lap it all in. I mean, what we're experiencing now at the moment, Farhan, is incredible. The amount of knowledge that is available right now for free from some of the top people. It's unbelievable, honestly.
Yeah.
You know, it's a webinar tsunami, and you have to jump in and grab whatever you can, because these guys are going to go behind paywalls in a month or two. All this information you're going to pay for, so grab it now. So learn. The other thing I put on there. The other thing I put down is to reflect. You know, is to really, really reflect. When you have a problem, go back and in the dark of night say, why did that happen? What could I have done better? Where was it that I needed to get better? What is it I need to go and do? So reflection is important. And for me, one of the best tools for reflection is photography. When I take photographs of my work and I look back, some things that I thought looked great, I look at now and I think, oh my Lord, I did that. Some things I look at and I think, okay, I did all right, and that works. So the reflection, I think, is the important part. It leads back into the reading, and I think that then creates a cycle where you improve and keep getting better. The final thing I'd say is to teach.
Okay, yeah.
Because you'll understand this. I mean, all these other guys we're talking alongside some great guys, you know, in the group and over the next week. But you really, really do have to fundamentally understand something when you teach it. You have to understand it. You have to understand what it is about it, the little subtleties and the nuances. But when you try to teach it is when I think you fully understand it. And so if you get to the point where you're actually teaching someone, then I think your level of knowledge and understanding goes up. And that's why you're being involved with groups like, you know, the RRT, the Royal College of Surgeons, the University of Frankfurt. All of these people has really, you know, BAAD, British Academy of Aesthetic Dentistry, British Academy of the ADI, you know, all of those things, and the teaching on them, I learn every time I teach, because the questions that come up question my knowledge, and you know, means that I go back to try and find out more.
Oh, unbelievable. I mean, great, fantastic advice, Martin. I mean, some of the stuff, it's just, I mean, I'm taking on board and soaking it. But just to go back to reflection, you know, I knew about reflection obviously through dental and medical training and whatnot, but my mentor George, he was anal for a reflection. We'd finish a case and be like, right, let's go out and we need to talk about it. And even if it'd been a long day of surgery and I'd be travelling back up north and he'd be going home, he'd phone me, we'd call each other on the way home and talk for 45 minutes, an hour, analysing every single step. You know, that went good, that didn't go well, what could we do next time, etc. And really, you know, really reinforce the learning. And you know, I echo that. You know, reflection is crucial in our development as implant dentists. Martin.
Yeah, and I think it means that you continually look at what you're doing to make sure you keep your own standards up. Yeah. And I think, you know, I'm with people, I'm talking alongside people who think the same, but it's important. That part's really important.
Great. Martin, thanks for taking up enough of your time. Just to remind everybody, tonight, 7:30, the link will be on my feed. Martin is giving a lecture on FP1 versus FP3. If you've not heard Martin speak before, you're in for a treat. Sign up to the webinar tonight, 7:30. You will not regret this. Martin, best of luck, and I'll see you at 7:30. Thanks, Martin.
Webinar this evening. I look forward to that. He's also, Farhan hasn't mentioned, he's doing a great one on pterygoid implants, which I will be tuning into, because we talk about learning, we talk about reflection. What you're seeing there is you're seeing the man who taught me about pterygoid implants. I went on his course to learn it, so really, I'm still learning every day, and I look forward to your lecture too.
That's not true. You're too kind. That's not true. It was George. Thanks. Take care. Bye. Okay. So, you know, what absolutely immense words of wisdom from such a well-experienced and humble colleague, Martin Wanendeya. And to repeat, 7:30 tonight. The links are all over Facebook, but I'll also put them on my feed. Now, I did have someone else on as well, and we're just going to crack on. I've been talking for a while. So now I've got a younger colleague starting off in implant dentistry, and he had some questions, and his name is Ali, and he is from the Midlands, the West Midlands.
Can you hear me, Farhan?
Yes, great. Ali, Great to have you. We spoke this morning. I think last week you sent me a number of questions and I would love to answer them as best I can live so we can benefit as many people as we can with some advice. First of all, tell us a little bit about you, Ali.
So my name is Ali. I graduated from the book and that was in 2015. And I'm 4 years off graduation. I'm currently doing in my second year right now. So I've done around 7 cases, 3 or 4 cases. Nothing quite complex and advanced. So I did ask you some questions on Instagram. You did mention it's quite good to discuss it on a live so that everyone can benefit. So can you hear me properly, Farhan?
Yeah, no, not really. If we can't really see you, we can only see half your face. Let's see all your beautiful face.
Right. Okay.
That's it.
Can you hear me though?
It's a bit broken, but ask the question and I'll repeat it.
I've got one main question and it's got 3 aspects to it. The question is with regards to implant training for a clinician. If we consider that as a journey, starting from simple, straightforward, slap and done cases, as you mentioned, starting from those cases to the advanced large stuff or extramedullary, that kind of stuff there. What are the key milestones, in your opinion, in that journey? The milestones could be referring to certain type of procedure, could be sinus grafts, could be a certain patient and fitness, for example, immediate loads, that kind of stuff to consider as milestones. The second aspect is basically what you consider or is the best time, or what would you advise as to when a clinician move from one milestone to the next one, doing that independently, basically. So is it a certain number of procedures? I do understand the confidence levels and the width and stuff, but what kind of rough number would you expect to get to the next level?
Okay.
If that's the case.
So Ali, can I answer the first question? I'm just going to repeat it.
Yeah.
So Ali, dentist from the West Midlands, just starting off in his implant journey, asks the question, how should he progress within implant dentistry in terms of complexity of procedures? Is it, where should he be going? When should he bring in sinus lifts? When should he be doing immediate load, etc., etc.? So, quite simply, really, absolutely, you want to start off with simple cases. What I mean by a simple case is, for example, a lower 6 or right 6, an abundance of bone, and you're just lifting a big flap and you can just throw that implant in. So that'd be the kind of, and you want to do a number of them to get your confidence in the drilling, using the system that you want to use, become aware of all the componentry, be confident raising a simple flap, suturing a simple flap, and that's the level you want to start. Then you start moving on to maybe, premolar region and move further forward, because as we move further forward, obviously the aesthetic demands are higher from our patients. But when we move forward, maybe you want to be treating a patient that doesn't have such high aesthetic demands. So don't be treating that 23-year-old female with a high smile line, as your first aesthetic case. No, how about treating the 60, 70-year-old patient? I'm not saying that they're, we're not doing as, the best for them. No, but maybe that patient with a lower smile line, that's how to gauge it. So that's the simple implants. Move from the back forward, and depending on the aesthetic demands of the patient. The first cases that you pick are so important, and risk assess them. Consider their medical history. Do not treat smokers. It's asking for trouble. Do not treat smokers. And then when you start going into grafting, start with small grafts, so simple GBR, where it's not so crucial, but and get used to raising flaps for GBR and relieving a flap and getting tension-free closure. Get used to working with different biomaterials, and then start to understand the different biomaterials that are available in the market and how to utilize them. Understand how to manipulate a membrane and how to tuck it under, and how to do internal horizontal matro sutures to locate it, and maybe experiment with tacking a membrane. So there are a number of ways to hold a membrane down. Remember, grafting, 2 important factors, space and stability. So thinking about these, and as you move up in experience, you're then learning all the time. Then from small grafting, you can go into bigger grafting, that you can develop into multiple implants. And so it's small steps, but making sure that what you're going behind, leaving behind, that you're competent and comfortable. And along that journey, you've got someone by your side, a mentor, someone holding your hand. And it comes on to the second question you asked, how do you know it's okay to step on, step up the ladder? Well, your mentor is that person to tell you, Ali, I'm happy with how we're getting on. I'm happy with your development. I'm confident that you have an understanding, and I'm happy for you to do this on your own. But even a mentor doesn't let go just like that. There were stages where I had my mentor side by side. I had my mentor in another room. Then I had the mentor on the phone the day before and the morning of. And then you get to a stage where you're speaking to the mentor afterwards. Oh, I did this full arch, and this is how it went. So that relationship with your mentor is also a journey that grows, as does your knowledge and your skill level as an implant dentist. So don't be doing immediate load on a central, on a high aesthetic case. Be sensible, build it up, and build up your experience. It's so important. So grafting in itself has a gradation of difficulty. Implants in itself has a degree of difficulty. And for instance, full arch, a lot of the work I'm involved, it has degrees of complexity utilising conventional pterygoid, zygomatics, etc. So it's about being sensible, and if you're not sure, then ask somebody. And there's plenty of people willing to offer advice. Was there another question?
Yeah, so from what you mentioned, basically, let's say, for example, if you get a case that is at one point level at that point in time, would you advise, your colleague or would you advise me to call my mentor in and use his help to get it done just to gain the experience? Or would you advise us to pass it on, to the mentor and observe instead of that methods?
Look, I think just so I've got it clear what you're asking, because I lost connection a little bit. So at your stage, if you had a full arch coming to you,
be it a full arch, just be it something that's complex.
Okay.
Like a spine, things that's above my current.
Look, I think there's two things to do here. So it's your patient, and that patient often will trust you, and you want to be there with them on the journey. So you've got two options. You refer to a more experienced colleague, but you follow that patient on that journey and you gain the experience. So if you're referring the patient on to another clinic, you say, well, if you don't mind, can I come along? I want to be there, maybe assist you in surgery. So you're gaining experience. I think that's crucial. The second thing I would say, another alternative option is you maybe get your mentor who's comfortable doing that to come in and do it in your clinic with you, and you assist. So there's two ways of doing it. But the thing with doing it in-house, there's a benefit that you keep the income generated within the practice, and as practice owners we all want to do that. But your practice needs to be set up, and it needs to be the right environment. The nursing staff need to be trained. You need to have the equipment, etc., to be doing those complex procedures. If that's not the case, then really, maybe the best way forward is that you pass on that work to another clinic and you follow that patient on that journey.
Right. The last aspect was basically the same journey that you discussed, with increasing complexity. What courses do you advise, basically, along the way that can be useful? You mentioned a basic course to start off with, if you've been with moving on, what kind of courses would you recommend? What to consider, be it soft tissue grafting,
okay.
Bone grafting, or full art courses, basically.
Okay, so I can really only talk from my own experience. I did a very simple hands-on implant course. It was with live patients. It was in the area that I live. It was in Glasgow. and I picked it for convenience, and it was fine. It suited me. It gave me the theoretical knowledge, and it allowed me to have hands-on. But my learning has all been from my mentors, and as I've mentioned before, they've been absolutely crucial. So my mentors is where all the learning happened. I got the certificate from a course, but the learning's all been from mentors, really. And in terms of courses that I've got along, I've really been, to be honest, I've learned from a lot of courses because I've been fortunate. My mentors, they've held courses, and I've been on the courses with them, helping them, and then as time's gone by, I've been able to teach on the courses along with them, which has been really beneficial in my learning. I've certainly been to a few conferences and courses, but I'm quite reluctant to go on a lot of courses unless I really feel I'm going to get value. Something I did about 3 years ago when I learned zygoma implants is I went to Brazil, and we did a 1 week live training, and that was incredible. 1 week intensive training, and we're just doing implants morning, afternoon, and you come back, and you've learned that skill and you're ready to go. So something like that in the right environment is priceless. So that's been really beneficial. And later on this year, I'm going to Budapest to spend 3 days with Estevan Urban, but I'm doing his full regenerator program. So that's a course that I'm doing later on this year. And so they're the two things that I've done recently that have had a huge impact in my career. Going to Brazil to do a hands-on course on zygomatic implants. 2, I am planning to do the Estevan Urban course later on this year. It's a 9-day program split into 3 sections.
The Brazil one, is there an institution that kind of have patients lined up for you when you go there?
Yeah, so the Brazil course that I'm now a part of, and when I went to learn zygoma work is a private clinic, is one individual, and he can really pretty much arrange whatever we need in terms of taking delegates over, and when we were there, he had an abundance of patients for pretty much any dental procedure that you wanted to upskill in. So it was brilliant. I would say, I've been fortunate that through my links with the colleagues that I work with, there's numerous courses that I've been on, and now I teach on block grafting course, and a full arch course, and a pterygoid course, and a zygoma course, and it's going to these courses and networking with other colleagues that really shape your path within implant dentistry, and that's what I would say. I think I've answered all. Was that helpful? I hope everybody else found that helpful too. I'm going to have a look. Ali, great. Keep in touch. Best of luck. Thanks for coming on. I'm just going to see if there's any questions that anybody wants to ask me. But take care. I'll catch up with you soon. Okay. Okay, I've got great feedback. Lovely. Everybody's waving. Great to see if there's any questions on Instagram first. Any questions, please pop them up. I don't think I have any on Instagram. I'll have a look. Right, Facebook. Any questions about today? So we were very fortunate. We had Martin Wanendeya on first, and he talked about some very specific questions that have shaped his career, and superbly successful, and so much more to give to the profession. He's on tonight at 7:30, FP1 versus FP3, as part of the ORG Oral Reconstruction Group, and that's tonight at 7:30. So I'll put up a link for that later on my feed straight after I come off. And then we had Ali, who's a young implant dentist in the West Midlands, and he had some specific questions that I hope I was able to answer, and everything, and it was helpful to everybody. My dear friend Tahid asked me, how do you identify the right mentor? Sometimes you're fortunate like I was, and it just happens, and you're two individuals that get on. But really, maybe, I suppose to a degree, it may be a little bit of trial and error, but ultimately, there needs to be a friendship, there needs to be mutual respect, and that mentor needs to have a vested interest in you and your development. And, you have to get on with them, because, you end up spending a lot of time with each other and spending a lot of time on the phone together. So, being able to get on and having similar values is crucial. Thanks. Implants is a steep curve. Great. Hope this does okay. George, who's organising the webinars with the ORG, is just making sure that Martin's internet connection is better than it was earlier on. Okay, great. I think that's it. Really appreciate all the comments, everybody tuning in. This has been quite a long live event. Well, I'll be back maybe Friday. No, definitely Friday. Maybe sooner. I've got a few people that I thought I would bring into the conversations to get their insight, get their advice, because together we learn faster, and we learn, learning is faster and better. So everybody stay safe, good night, and take care of yourself.